Abscess or empyema? Well, both can look like cavities on the imaging, right? But here's the 1 minute hack to never miss the difference. First point is shape. Well, if you look at the chest x-ray, abscess is having a air fluid level, as you can see in this particular radiograph, showing the air fluid level as it is very popular. Whereas if you talk about the empyema, it may show a thick pleura, which is outside the lung parenchyma, whereas in the abscess we see inside the lung parenchyma. So that is the first important point as far as chest x-ray is concerned. If you talk about the CT scan, abscess is having a round or oval cavity, which is inside the lung parenchyma again. In the empyema, if you talk about, then there is a lenticular or biconvex shape, as you can see in this particular CT, right? That is in the pleural space, not in the lung parenchyma. Second point about the wall. In the lung abscess, there is a thick, irregular, shaggy wall. There is a thick, irregular, shaggy wall, and in the empyema, there could be a thin and the smooth wall. That is the second difference about the wall. Third one, what about the angle with the chest wall? So if we talk about the angle with the chest wall in the lung abscess, usually there is a acute angle, as you can see here. And if we talk about the empyema, usually they are having a obtuse angle, as you can see in this particular CT, right? Abscess often shows an air fluid level because of the bronchial communication, whereas empyema may compress the lung and sometimes they may have the mass effect, and which may show the classic split pleura sign. As you can see, this is the parietal pleura and this one is the visceral pleura, which is separating from each other, and in between that we can see there is a fluid inside, which is usually the pus in the case of empyema. Thank you.